Hello everyone. Today I will discuss about introduction to medical imaging. Medical imaging, also known as radiology, and it is the field of medicine in which medical professionals recreate various images of the parts of the body for diagnostic or treatment purpose. Medical imaging procedures include non-invasive tests that allow doctors to diagnose injuries and diseases. Medical imaging is a central part of the improved outcomes of modern medicine. Different types of medical imaging procedures include X-ray, CT scan, MRI, and ultrasound. Medical imaging of the human body requires some form of energy. In the medical imaging techniques used in the radiology, the energy used to produce the image must be capable of penetrate the tissue. Visible light, which has limited ability to penetrate the tissue at depth, is used mostly outside the radiology department for the medical imaging purpose. Visible light images are used in dermatology for the skin pathography, gastroenterology, and obstetrics, as well as pathology. In diagnostic radiology, the electromagnetic spectrum outside the visible light region is used for medical imaging, including the X-ray in mammography, radiography, as well as CT scan, radio frequency pulse in the MRI scanning, and gamma ray in nuclear medicine. Mechanical energy in the form of high frequency sound wave is used in the ultrasound imaging also. With the exception of nuclear medicine, all medical imaging requires that energy used to penetrate the body's tissue also interacts with those tissues. In nuclear medicine imaging, radioactive substances are injected or ingested, and it is the physiological interactions of agent that give rise to the information in the images. The diagnostic utility of a medical image relates both to the technical quality of the image and the conditions of its acquisition. Consequently, the assessment of image quality in the medical imaging involves very little artistic appraisal and a great deal of technical evaluation. In most cases, the image quality that is obtained from the medical imaging devices involves compromise. Better X-ray image can be made when the radiation dose to the patient is high. Better magnetic resonance images can be made when the image acquisition time is long, and the better ultrasound images result when the ultrasound power level are large. Of course, the patient's safety and comfort must be considered when acquiring the medical images. This excessive patient dose in the pursuit of the perfect image is not acceptable. Radiography was the first medical imaging technology made possible when the physicist W.C. Röntgen discovered X-ray on November 8, 1895. Röntgen also made the first radiographic image of the human anatomy. Radiography is also called as Röntgenography. It is defined the field of radiology and gave rise to the radiologist physician who specialized in the interpretation of the medical images. It is performed with an X-ray source on one side of the patient's body and X-ray detector on the other side. A short duration, typically less than half-second pulse of the X-ray is emitted by the X-ray tube. A large fraction of the X-ray interact in the patient, and some of the X-ray passes through the patients and reach the detector, where the radiographic image is formed. The homogeneous distribution of X-ray that enters the patient is modified by the degree to which the X-ray are removed from the beam by scattering and absorption within the tissue. The attenuation properties of the tissue, such as bone, soft tissue, and air inside the patient, are very different, resulting in a heterogeneous distribution of X-ray that emerge from the patient. The radiographic image is the picture of this X-ray distribution. The detector used in the radiography can be a photographic film, for example, screen film radiography technique, or an electronic detector system which is used in the digital radiography. Transmission imaging refers to the imaging in which the energy source is outside the body on one side and the energy passes through the body and is detected on the other side of the body. Radiography is an example of transmission imaging. There are different types of the modalities used in the field of medical imaging. The different modes of making the images are referred to as modalities. Each modality has its specific applications in the medicine. So first is the conventional radiography. Conventional radiography, also called analog radiography, plain film radiography, or projectional radiography, and it is the fundamental diagnostic imaging tool in the detection and diagnosis of disease. X-rays reveal the differences in the tissue structures using the attenuation or absorption of X-ray photons by materials with high density like calcium-rich bones. Basically, a projection or conventional radiograph show the differences between the bones, air, and sometimes fat also, which makes it particularly useful to assess the bone conditions and chest pathologies. Low natural contrast between the adjacent structures of the similar radiographic density requires the use of contrast media to enhance the contrast of the particular image. In conventional radiography, the patient is placed between the X-ray tube and a film or detector sensitive for the X-ray. The choice of film and intensify screen influence the contrast resolution and spatial resolution. Chemicals are needed to process the film and are often the source of error and retake also. The result is a fixed image that is difficult to manipulate after radiation exposure. The images may be also visualized on the fluoroscopic screen, movie, or computer monitor. Next is the what is fluoroscopy? Fluoroscopy refers to the continuous acquisition of the sequence of X-ray images over a time, essentially a real-time X-ray movie of the patient. This system uses X-ray detector system capable of the producing the image in rapid temporal sequence. It is used for the positioning of catheters in the arteries, visualizing the contrast media in the GI tract, and for the other medical applications such as invasive therapeutic procedures where real-time image feedback is required. It is also used to make a X-ray movie of the anatomic motion such as of the heart or esophagus. So this is the example of real-time modality. Next is the computed radiography. Computed radiography is an imaging technique that uses the similar equipment to conventional radiography, except that the films are replaced by the imaging plate. An imaging plate contains photo-stimulated phosphor, which stores the radiation level received at each point in the local electron energy. The imaging plate is the place under the patient in the same way as placed the conventional film cassette. After X-ray exposure, the imaging plate is run through a special scanner to read out the image. The digital image can then be processed to optimize the contrast, brightness, and zoom. It can be seen as a halfway between the film-based conventional radiography and current direct digital radiography. So this is the example of CR system, including the scanner, printer, as well as monitor. Next is a digital radiography. It uses a special electronic X-ray detector which converts the radiographic image into a digital picture for review on a computer monitor. The digital image is then stored and can be post-processed by changing the magnification, orientation, brightness, as well as contrast also. Digital radiography, also called direct radiography, and it is a progressive development of computed radiography. This development can lead to fewer recalls, including a lower radiation dose than analog or conventional radiography. DR and CR system use no chemical to process the X-ray image, and the hazardous materials and waste associated with film development are eliminated. So this is the example of DR system. Advantage of the digital radiography compared with the conventional radiography. It saves the time and cost due to more effective imaging process and workflow. It improves the diagnostic quality image also in case of X-ray underexposure or overexposure. Lower the repetition rate. Digital images are storable on the disk or in the PACS system. Film and developing chemicals are omitted and detection of hazardous chemical waste. Next is the mammography. Mammography is the radiography of the breast or mammary gland and is thus a transmission projection type of imaging. It is used to screen the asymptomatic women for the breast cancer called screening mammography and is also used to aid in the diagnosis of women with breast symptoms such as the presence of a lump called diagnostic mammography. Next is the computed tomography or CT scan. It became clinically available in the early 1970s and is the first medical imaging modality made possible by the computer. CT images are produced by passing an X-ray through the body at a large number of angles by rotating the X-ray tube around the patient's body. A detector array opposite the X-ray source collects the transmission projection data. The numerous data points collected in this manner are synthesized by a computer into a tomographic image of the patient. The term tomography refers to the picture of a slice. CT scan is a transmission technique that results in images of the individual slab of tissue in the patient's body. So this is the CT scan equipment. Next is MRI. MRI is a non-invasive imaging technology that produces the three-dimensional detailed anatomical images. It is often used for disease detection, diagnosis, and treatment purpose. It is based on the sophisticated technology that excites and detects the change in the direction of the rotational axis of protons found in the water that makes up living tissue. So basically, the MRI scan is based on the protons, hydrogen protons. MRI scanners are particularly well suited to image the non-bony parts or soft tissue of the body. They differ from the computed tomography in that they do not use ionizing radiation. The brain, spinal cord, and nerves, as well as muscles, ligament, and tendons, are seen much more clearly with MRI than with regular X-ray and CT scan. For this reason, MRI is often used to image the knee and shoulder injury. Next is the ultrasonography. It uses the high frequency sound waves to produce the images of the internal organs and other tissue. A device called transducer converts electrical current into the sound wave, which are sent into the body's tissue. Sound waves bounce off structures in the body and are reflected back to the transducer, which converts the wave into the electrical signal. A computer converts the pattern of the electrical signals into an image, which is displayed on a monitor and recorded as a digital computer image. There is no X-ray are used, so there is no radiation exposure during an ultrasonography.